Good morning to one and all present here. Today I am going to present on the theme Pearl into Peril. You will all wonder what this theme is all about, but as I go into the presentation, you will be let to know. So this is the gist of the presentation. Actual topic is odontogenic space infections, where I am going to start from how an initial carious lesion is going to cause space infection, that is involving various spaces, and then later leading to further complications. First, introduction. What are spaces? So as we say, it is not actually a space, it is just a potential space. That is, it has some contents within it like blood vessels, nerves and all, and they become space only when they get infected actually. So when there is a purulent exudate formation occurs within those spaces, that is actually called space infection. So next, spread of infection. How a odontogenic infection, that is either from a dental caries or a periodontal disease or pericoronitis, which is the condition which I will explain. How all these are leading to facial space infection is what I am going to explain. So first, an initial dental caries, when it is progressing into the pulp, which is the vital tissue of the tooth, and later going to enter into the periapical region, it might cause abscess and then it can enter into the dentalveolar region, leading to the nearby spaces. Next is the periodontal disease, which occurs due to more plaque and calculus accumulation around the tooth, which is going to cause disease to the periodontium which is surrounding the tooth, which can then enter into the spaces as before that it forms into a periodontal abscess. Next is pericoronitis, which is nothing but a flap which covers the usually occurs in third molars, which acts as an area for food impaction. So later it can cause infection which can enter into the subsequent spaces. Next, factors determining the infection spread. So one is microbial factors, that is if there is increased virulence or increased quantity of the microbes, there might be infection. The other way is host factors. If the patient is immunocompromised, then there is more chances of infection. Next is routes of spread. One is direct, the other one is indirect. Direct spread is first into the superficial tissues, then it can enter into the spaces and then into the medullary space of bone itself. Then indirect route is it can spread through hematogenous and lymphatic route. Initial signs of infection is common as we see in any infection, and then other signs would be lymphadenopathy, halitosis, trismus, difficulty in swallowing, breathing, and draining sinuses can be visible. Next is classification of space infections. Primary maxillary spaces. So here the foci of infection is from the maxillary teeth. So first is labial vestibular space, where the swelling is seen in the almost near the upper lip and philtrum is getting obliterated because of that. Next is canine space involving the canine fossa. So a swelling is seen lateral to the nose. Sometimes it can also cause lower eyelid edema. Next is infratemporal space, where the TMJ region and along the zygomatic arch will be able to see the swelling. Severe trismus is the marked sign in this particular infection. Next is buccal space, where it has communication with both maxillary spaces as well as mandibular spaces, and a severe swelling can be seen in the cheek region. Next is primary mandibular spaces. So here mandibular teeth are the main foci of infection. Next, first is submental space, where over the chin region a small swelling can be seen. Next is sublingual, disturbed because of this. Next is submandibular space, where cone-shaped swelling can be seen involving the lower border of the mandible up to hyoid bone. It can be involved. Next is secondary spaces. So in that first one is pterygomandibular space, where mainly due to pericoronitis, which I talked about earlier, that is the main cause for the swelling. Next is mesenteric space, where the swelling is seen over the ramus of the mandible, which is the area of insertion of masseter. Next is superficial and deep temporal space. So here a marked sign is a dumbbell or a hourglass shape. Why? Because the superficial and deep swellings will be present in between. The zygomatic arch will not have any swelling, so it gives that particular sign. Next is lateral pharyngeal and retropharyngeal space. So this can be because of the mandibular, pterygomandibular space infections which are extending later. So where a pharyngeal bulge can be seen and patient might have pain while turning to the opposite side. Next is prevertebral space, where on X-ray examination we will be able to see prevertebral widening. Next is radiographic diagnosis, an IOP, that is intraoral periapical radiograph, orthophantomograph. These are used initially for identifying any odontogenic infection. Later, CT and MRI can be used to identify any soft tissue damage. Going on to management. So initially an antibiotic regimen has to be started for any patient with space infection. And then the first initial treatment should be Hilton's method of incision and drainage if the abscess is present intraorally, where just a stab incision will be placed over the abscess and the drain will be placed in order to drain the pus later. And next is extraoral incision and drainage, where the dependent part of the swelling will be marked and it will be incised and blunt dissection will be done and a drain will be placed for further drainage. Next, the main important thing is the odontogenic infection has to be treated first so that it's not going to lead to any of these. So, first the etiology has to be addressed. If in case the tooth is in a position of getting safe, it can go for a root canal treatment. Otherwise, if it is grossly decayed and the infection is more, then it has to be extracted to prevent it entering into any other spaces. Next is fluid intake. Any patient has to be hydrated during this period. Next, going on to complications. First, Ludwig's angina is the most common complication, where the patient will be toxic and almost the lower face will be completely swollen, and because of that the tongue will be elevated from the floor of the mouth and it can fall back also, so which can cause further respiratory distress later. So initial management will be incision and drainage, similar to what I said before, but here since both sides are involved, bilaterally incision has to be given as well as in the midline, and a drain has to be placed to drain the pus. And along with that, airway management is very necessary in such cases where endotracheal intubation or tracheostomy can be done. Next, going on to cavernous sinus thrombosis. This is also a most important complication where the patient will have retrobulbar edema and retinal hemorrhage. Next is antibioma. This is a condition which occurs due to inappropriate use of antibiotics without actually treating the cause, that is without incision and drainage. So coming to conclusion, pearl can turn into peril if left untreated. So this is why I just named the theme like that, because even a small carious lesion or a periodontal disease, initially if it is not getting treated, it can turn into a space infection and if again it is not treated, it can lead to life-threatening complications. So better to diagnose it earlier and treat it to prevent these complications. And there are few cases reporting to Department of Dental Surgery with abscess or space infection as well. So we are treating it earlier, so they are not facing such complications. So if you doctors are able to identify some patients with these clinical features, kindly refer them to Department of Dental Surgery so that they can be diagnosed earlier and treated earlier. Thank you to Dr. Suresh Kumar sir, HOD of Department of Dental Surgery, and to all the other assistant professors for giving this particular opportunity to me. Thank you.